on to our next panel, we look at the warriors of healthcare, women who have donned their scrubs and personal protective gear with guns blazing, trying to combat COVID-19. As much as COVID-19 has filtered through many areas of our lives, indeed, the most important aspect is that it's a health issue. It started off as a health issue, and in order to combat the virus, we must first look at that very pertinent aspect of it. And I will be joined by women who have indeed been fighting for us on the front lines. We often hear about health workers. I feel like a lot of us have not seen health workers, and it feels like we see them from afar, but we will actually be getting stories from them on how the virus has impacted them and their work. Here are our panelists.
Professor Quarraisha Abdool Karim is an infectious disease epidemiologist and Associate Scientific Director of CAPRISA. She is Professor in Clinical Epidemiology at Columbia University, New York, and Pro-Vice Chancellor for African Health, University of KZN, South Africa. Dr. Anne Biccard has worked as an emergency doctor in Johannesburg for more than 30 years. She recently published her first book, Saving a Stranger's Life, The Diary of an Emergency Room Doctor. Noctu Lamkise is a mother, wife, registered nurse, surveillance officer, and community leader. She knew from early on that she wanted to help people. Nokuthula has been a nurse for 22 years. She has worked both in her community and abroad. She now finds herself at the forefront of the COVID-19 pandemic, working as a surveillance officer. The moderator is CNBC Africa's Zinathi Kuma.
Indeed, we have a panel of women that have been fighting for us. So on the front lines, those are health workers in South Africa's healthcare system. And I just want to start off with Professor Quarraisha Abdool Karim. I just want to take you ladies back to when you first found out about COVID-19. Professor, did you ever think, starting with you, and then we'll move on to Dr. Ann Pickard, and then to our resident nurse, going back to that first day when you found out about COVID-19 and the first case landing in South Africa, did you ever think that you'd be such a big part of the research and combating COVID-19 in the country?
Yeah. So this is not meant to sound arrogant in any way, but I'm an epidemiologist, and epidemiologists deal with epidemics, pandemics, and I've spent a large part of my life dealing with HIV, which is another pandemic. So we're like firefighters. If there's a fire, you don't run away from the fire, you go to it. So when we first started to hear about COVID-19, the first thing, which was actually sometime in December, we immediately started to look at what do we need to know, what do we need to prepare for. And way before that first case was diagnosed, we were already in the process of preparing for that.
Moving on to Dr. Anne Biccard, I remember I have noted that on the first day, that was the 5th of March, that the first case of COVID-19 was diagnosed in South Africa. It was actually your birthday. Tell me your thought process that day. Did that ruin any of your celebrations? Dr. Anne Biccard, I think you are muted there. Dr. Anne, I think that you are still muted. Please, can you unmute? All right, I think while we sort that out, let's go to our nurse, Noctu Lamkise. Welcome. I just want to go back. Being a nurse already, you are on the front lines even before COVID-19, and I just want you to walk me through the emotions that you felt when you found out that the first case of COVID-19 had landed in South Africa on the 5th of March, 2020.
Good afternoon, everyone. Can you hear me now?
Yes, I can. Thank you very much.
Good afternoon, everyone. Yes. It was actually a shock to all of us because we actually didn't know what to expect, and it just shows in our our surroundings, so we couldn't figure out what to expect. It was a very difficult situation on that time because we didn't know what to do in that situation. So it was really, what can I explain this? It was a shock because we couldn't figure out what to expect. We don't know what we're supposed to be doing, but it was really a shock.
And I think, Dr. Anne Biccard, you are unmuted now. And as I mentioned, it was your birthday on the 5th of March, that day that the first COVID-19 case was discovered in South Africa. How did that affect your birthday celebrations and just your thinking going forward about your job?
So can you hear me now?
Yes, I can. Thank you.
Okay, great. So we knew it was coming. I mean, we obviously saw it coming from abroad, and we knew that it would be arriving in South Africa. But I remember that I came into the ED, and I'm friends with a lot of the people there, and I went to go and hug them to say happy birthday, and they said, "Don't touch me, COVID is here." And it was a very memorable moment because we knew it was coming. We knew we'd seen the wave from afar. So all of the doctors knew it was coming our way, and we knew that it would show up. And then it did, but not quite like we thought it would. You know, we thought we would see the huge number of cases that we've really seen in the second wave now. We thought what we were seeing then was what we actually saw in the second wave, and hopefully what we won't see in any further waves.
Now, Prof, going back to you, you know, a lot of us, when COVID-19 came, we were all in a panic about South Africa's healthcare industry, the capacity that it would take for us to actually survive this virus. And I just want to know from you, I mean, having come from a place where you are a researcher for HIV and AIDS, how did COVID-19 change your perspective on South Africa's healthcare industry?
Yeah, that's an excellent question, Silati. And I think, you know, in February, early March, when we were starting to prepare for the potential epidemic to come, we were struck by the visuals from Italy, from the UK, from the US. And as Anne pointed out, I think in the first wave, we were better prepared than we were in the second wave. I think that other epidemics that we've been a part of preparing for in Africa, particularly, like the Ebola epidemic and then HIV, really laid some important foundations for our ability to respond. And I can, you know, think of several examples. For example, just like the testing platforms we had for HIV was an important part. The contact tracing that through community health workers that we had in place for TB was all very important. And I think that our ability, one, as a country to respond, and two, to be better prepared, was one part of it. The second part of it is that in Africa, we typically imbibe knowledge that's generated in other parts of the world. And so although we had the ability to do the testing, we quickly realized there were shortages. There were lots of shortages, PPEs. There were shortages of reagents. There were shortages of testing kits. And, now we're learning we're at the end of the queue for vaccines. So I think the key point, I hope the lesson we learn in taking this away is how much more we need to be investing in our healthcare delivery systems to ensure that we have equitable access to healthcare across the board. And we have a long way to go in terms of reaching that goal.
Dr. Anne, talking about the panic in the healthcare industry, I mean, you are right in the thick of it. An emergency department doctor, it's already tense even before COVID-19. Now, COVID-19 comes, and I know that you guys have a kind of a hierarchy in terms of the emergencies that you prioritize. How did that change your job in terms of the emergencies? Because, I mean, normal emergencies pre-COVID-19 are now going to be falling away to make way. Well, did they actually fall away and make way for COVID-19 related emergencies?
So strangely enough, most of the stuff we saw on a day-to-day basis seemed to kind of disappear when COVID arrived. So going back to the sort of lockdown and the time that we needed to get prepared, we needed that space to get our ventilators organized and get our wards organized and everything. And we scurried around and tried to get organized, and we weren't really sure what we were preparing for, but we were trying to get prepared. And then pretty much nothing happened, I would say, for about 2 or 3 months. And that was the strangest thing. It was like the lull before the storm. The patients just disappeared. The people who would usually be coming to the ED with heart attacks or strokes, they weren't coming. There was just no one. There were no COVID patients. There were no other patients. We literally sat around for 6 weeks or 2 months. And then we started seeing the numbers of the COVID patients. And obviously the big problem is trying to stream the patients into 2 different streams so that we know who's getting exposed to COVID and who's not. So it doesn't really affect the emergency room in that if somebody comes who's having a heart attack or a stroke, we already have a system to triage those patients and get them through and get them help before somebody who's maybe less sick than them. But now with COVID, in the first wave, we were trying to do the test, the PCR test, which was taking days and days. In the meantime, we had to find somewhere to put the patient. In the second wave, the patients were coming and saying at the door, I'm COVID positive, I'm a week down the line, I'm short of breath, I'm coughing. So it was a totally different demographic. I mean, the patients were already getting tested. They already knew that they had COVID pneumonia. We already had all the systems in place. The first wave was certainly, I mean, I actually think we did really well. I have to say, looking back, I think South Africa, exactly as Prof says, was stepping 3 months behind the rest of the world, and we learned a lot of lessons from them. We took in every single thing we could, and I think our team was amazing. I mean, if I look at our ICU teams, at our government hospitals that just kept up with everything, set up the wards, took the patients, I was pretty impressed, I have to say. I was anticipating much worse. I thought that the healthcare system would just collapse like a house of cards. But it actually didn't. People stepped up to the line and they did their work, and to my knowledge, no one's been turned away. So that's great.
And I mean, Doctor, you say that, the lockdowns helped in terms of the emergencies where you weren't getting the same types of emergencies that you were getting pre-COVID-19. But I'd just like to know, now that we've moved on to level 1, things are much more open and freer now. Have you noticed a change and have you maybe reclassified your emergency hierarchy?
So there's no question that the banning of alcohol made a massive difference in South Africa. I mean, the trauma cases just went down. Those are beds, those are theatres, those are doctors that are taken up with that. So no question, we needed that time to get ourselves ready, and we needed the space in the ED to get those patients sorted. The question is what's going to happen next. So we've kind of stayed afloat. I think our economy's taken a massive knock. We're tired. I mean, speaking for myself and all the healthcare workers I work with, it's a year down the line, literally almost a year, and we are tired. It's still us. It's still the same 10 people on the front line in the hospital where I work. But the question is what's going to happen next. So are we going to get vaccinated and not see a third wave? Is the third wave coming our way anyway? That's, to me, the major question.
We seem to have lost Nurse Nokuthula Mkhize then. I was actually about to ask her if she has been vaccinated. Of course, we know that health workers are currently being vaccinated right now as the first line of defense. And I actually just want to know from the whole panel, have you been vaccinated? Starting with you, Prof.
So I was hoping you don't ask me that question. So I don't take care of patients at the front line. I work doing the trials, supporting the trials, trying to understand the transmission and working at a population level. And, I think both Nokuthula and really capture what life it has been like at the front lines, having to admit patients, having to see patients die. That's the last thing healthcare workers want. Is they've joined this profession to save lives. And with COVID, we've seen loss of lives, loss of livelihoods, and social cohesion coming apart. And so I have not been vaccinated yet, not because I don't believe in the vaccines. I think we have some amazing vaccines there. And I think it's the right priority to vaccinate first those who are at the front line taking care of patients who are sick. And hopefully we can prevent their deaths. And we can make sure that healthcare workers remain safe and also feel safe returning home to their families. So I'm going to wait till the next level when my age allows me to be vaccinated.
Wait till your turn, Prof. And we have Nurse Noctu Lamkise back. And as we know, the first person that was vaccinated in South Africa is a nurse, actually, Zoliswa Kitikyose. And I just want to find out, Nurse, have you been vaccinated?
I'm looking forward to it, but I still have to wait for my turn. Remember, you have to register and then you have to wait for the voucher and then you can get vaccinated. So I'm looking forward to it.
Okay, Dr. Anne Biccard, because you are really out there on the front lines of fighting the war against COVID-19, have you been vaccinated?
So now I'm going for my vaccination on Thursday. Also had to apply for my voucher, I had to wait my turn. I certainly, touch wood, having worked with the germ for a year, there were a lot of other doctors that I felt needed to go ahead, and they have been vaccinated the last week. Also quite difficult because they little bit of side effect, maybe feeling a bit achy and not so nice the next day. So I was kind of waiting for my next day off to put my name on the list. But yeah, I'm on Thursday and I'll be presenting myself to be vaccinated.
Nice. And just moving on to you, Prof. You have been a leader in terms of HIV research and TB research, and just even last year you were given an accolade by Bill Gates, adding yourself and your husband to the heroes list. And I just want to know, what are some of the lessons that you have learned from your previous research in terms of COVID-19 that you have applied for COVID-19 research?
Yeah. So thanks. If I had all day, I'd be here all day. Thanks. So let me just touch on a few issues. So the first is the centrality of science in terms of a response, looking at scientific evidence. And that's usually how we start with HIV and TB. With COVID, we actually knew very little. And in the past year, we've learned a lot, but there's still a lot of uncertainty. As you mentioned, we've learned from other countries, and it's a good, in a way, fortunate that we are a few months behind some of the other countries. So science, that's important. Two is leadership. And I think we've seen that brilliantly in South Africa from the president, Minister of Health, the whole cabinet, putting their weight behind this. Three is the importance of engagement of communities. And I think here again, we've seen how non-governmental organizations, community-based organizations have really stepped up to the plate. We've seen the importance of community health workers in terms of educating the communities, going out there, getting the message out, all the healthcare workers in primary care facilities, in hospitals, wherever they are, in the private sector, in the public sector. In fact, the partnership between private and public was really important. I think the interdependence, both within the country and also globally, is an important lesson. The importance of us working together and how working together we can move mountains. I think the other issue is around gender, and I just wanted to end on the gender issue, because it is International Women's Day. And here we are in the 21st century. In the Millennium Development Goals, there was MDG 5 for health, which is about maternal mortality rates. And so we made great progress in terms of reducing infant deaths, in terms of reducing overall disease burden on TB, malaria, HIV. But on maternal mortality rates, we've made very little difference. This is also, gender equity is part of the Sustainable Development Goal 5. And it's an issue that shockingly, we still have such wide divides at every level that we can possibly think about in health. When we look at adolescent girls and young women, they are at the bottom rung in terms of power, but are the most vulnerable. Indeed, 1 in 4 infections in Africa take place in young women under the age of 20. And, you know, as a continent with 65% of its population under the age of 35, it's something we cannot continue to take too lightly. We have to do more and better in terms of bridging gender gaps. Thank you.
Now moving on to Dr. Biccard. So I read your book, Saving a Stranger's Life, the Diary of an Emergency Room Doctor, and I actually could not put it away. And I just want to know, I mean, you started off, right in the thick of COVID-19. And I just want to know, from what you have experienced so far, is there anything that you would take away or add to your book? Or if there are any things that you would like to reiterate that are in your book that you would like all of us to know?
So I don't think I'd change anything, because I think it's really great to have a record, to look back when we thought 21 days was a long time to be cooped up, and then it was lockdown, Groundhog Day rerun. And then it was, just carried on, and it's been a year. So I don't think I would change that record keeping, because I think it's important to remember where we were. And yes, we have come a long way, but I also think we, as Prof said, we don't really understand this germ at all. It's a very strange thing. I mean, usually if you see a patient with pneumonia and you listen to their chest, you'll hear that pneumonia, you'll hear the crackles, you'll hear the fluid. Not with COVID, it's the patient's chests are usually clear as a bell, and yet you look at the x-ray and you're like, oh my word, this person's really in trouble. So I think there was a lot of fear for all of us, for the physicians, for the ED doctors, for the ICU staff. And the one thing I'd like to shout out maybe a little bit more is how, people initially were like very vocal about how fantastic it was, the healthcare workers, etc. And then things kind of got a bit quiet, because I suppose people got tired of shouting out to the healthcare workers. But those nurses particularly who've been on the front line have just been amazing. And you can have all the equipment, you can have every ventilator, you can have everything in ICU. If you don't have a healthcare worker, you've got nothing. So yeah, the one thing I'd say more of a shout out is to the team who stood their ground. Well done.
Nurse Mkhize, we lost you there for a bit, but there are 2 quick questions that I'd like to ask you. I mean, you were basically feeling and touching the virus, working as a nurse, as our first line of defense. And I just want to know, because, I mean, they say to all of us, don't bring work home. But I think for you, it's a little bit different, because in this case, there was a risk of you bringing work from home. How did life for you change? I can imagine that it was like a war zone, in the hospitals. But how did life change for you, especially at home, having, all these stringent rules at work, and then having that fear that you are going to be bringing the virus at home? How did your interaction with your loved ones change?
When you say war zone, I think it's not really a perfect word to say, because, in the war, you know what you're fighting. And then in the war, you know where your origin, where you're going. But for us, it's like, when you go there, it actually starts when you prepare yourself psychologically, that physiologically, and then you go to the hospital. When you're there or in the community, it's more of like, you have to tell yourself every morning that, okay, it's a solemn pledge that I'm devoting myself for the welfare of those that need my care. So it was really a tough situation, but end of the day, someone needs to do it. And then who else can do better than nurses? So the interaction between the families was quite a game changer, because when you're in the hospital, you have to comfort the patients. You have to wear different kind of hats, because remember, there would be no social worker, no psychologist in that unit if you're working in the wards. So when you're there, you are to be a counselor. You have to actually wear all different kind of hats. But it's differ when you're in the hospital, because you have to take blood, you connect. There's not much of like that 2 meters away, because you are there when the patients are finding it difficult to breathe. You have to be near the patient. You have to listen. It's a totally different story, because when you have to go home, you have to try by all means say, okay, I'm leaving this at work, but you're not sure that you're leaving this at work. When you go home, you have to make sure that, okay, I'm clean. Am I properly clean now? When you get home, okay, in the garage, we used to do that in the garage, you remove all your clothes and then you go and shower. Make sure that you clean. You tell your children that no huggies anymore, no hugs, nothing. It's even worse when you actually contacted the COVID in the hospital, because it's a game changer. You need to actually try by all means to make sure that your family is not contacted. But at the end of the day, they are your family, they are your comforts. But in the hospital also, as a nurse, you're supposed to give all the care that you can actually give. It's a different story when you're in the war. So for us as nurses, we always like say in my language that social because it means that when you're there, when you pledge to care, to take care of all those patients that are there. You're the only hope for them. So they fear, because they see your expression. As much as you're wearing all this PPE, but at the end of the day, the family and also the patients looking at you to give hope. So it was really a different kind of like situation when in the hospital. When you get home also, you have to just swap around all those, the interactions with your family per se.
Indeed, thank you very much. We do appreciate all the work that our health workers have done in order to combat COVID-19. I guess an interesting point that I've gotten from this conversation as well is, how we were panicking about our healthcare industry in South Africa and in Africa in general collapsing. And I think another thing that I have noted is that, our healthcare, capacity managed to, contain and to work to save people's lives. But at the same time, I feel like COVID-19 has also changed the way in which we view our health workers. And I feel like, the trust has leveled up in terms of people knowing that they can actually trust our health workers who are fighting for us on the front lines of the COVID-19 pandemic. Thank you very, very much, ladies, our real life heroes. Thank you very much for joining us.